Hello, today we'll be going over the code Narrator, and to get started we're going to arrive a patient. Okay, we'll just enter a little bit of information here. Let's say unresponsive. And now I'm going to go over here and open up the code Narrator. To initiate the code, we'll simply click Code, put the time the code is starting, or has started, and we'll accept. First thing we'll want to do is add our staff in here. We can enter providers here, and for this demonstration I'm just going to choose unknown for all of these, just for anonymity reasons. Let's add a registered nurse, and we'll go ahead and just add a respiratory therapist here and a tech. So now we have our team. Over here, it shows that they've arrived. And we're just going to go through some of the important tabs on the left side here. Of course, we already have done our code start. We have our quick bar, which if I click on that, we can see a few things here. So in your code, you can say that there are compressions being done or not, if the patient has a pulse. You can talk about bagging the patient here. There are several options that you'll always use here in a code. And then of course your defib, your pulseless rhythms, your rhythms, and some vitals information here. We have your condition at onset. We have vitals, rhythm, and oxygen. Some of your interventions here, which goes back to what you can find in your quick bar as well as some additional information. We have your code outcome. For a moment, I want to jump over to the right side of the screen where it talks about your code meds. So these are just some of the more common ones. For instance, let's say we're going to give some epi. I'm going to click on that. Looks like we'll have to put a provider in here. So let's say and let's think here. Okay, so I've got my RN who's giving the med, and I'll accept. When I give that epi, you'll notice on the bottom of the screen here a timer started. So that will keep track of how long it's been since your last epi. You can always stop your timer for when the code ends. If you don't see a medication over here on the right side that you are going to be administering, you can always search it down here. There's a button here to take you to the MAR to give you, a better picture of all the meds given and meds ordered. And then let's jump back to the left side of the screen. Got a few more things here. Pain, airways. Let's click on airways. Just as always, you place your LDA this way, and that should look familiar to you. IVs. So we've got all these here to choose from, and let's say, for instance, you're going to give you've started an IO. We got that right here. And again, place it just as you would any other LDA. We have blood glucose here. Tubes. So if you want to put your OG in here, it's going to work the same way as an LDA. So you can go in here and put your OG in here. Drains, wounds, some assessments here. Quick notes is important because this is where you're going to be charting most of your notes. Family updated, family at bedside. If I click vital stable, it's going to just default right to that for me. A blood transfusion. If I click on this, it's going to take me to the blood transfusion page. And we don't have any blood ordered on this patient, so we won't be doing that right now, but here is the page for that. And we're going to go back to the code narrator up here. And of course, this is going to keep a timeline for you. For everything done within the code. If somebody leaves, I can click them up here and have them, so let's say our tech left. Their timeout was, let's say, 5 minutes ago. So now they're no longer here. They've departed. Our code is ended. Let's say right now. The code is completed. I can go in here and put my condition at onset, or I'm sorry, my code outcome. Survival, yes, and then I can fill out the rest of that information here for my outcome. Alright, and that concludes the code narrator tutorial.